Hello, this is Dr. David Bilstrom, coming to you from the 27th Annual World Congress of the American Academy of Medical Acupuncture. I just saw an excellent lecture by a Dr. Nathan Bryan from University of Texas, who's a nitrous oxide expert. And he was talking about how important the ability of the body to produce nitrous oxide is to maintaining health and preventing chronic disease or reversing chronic disease. Now, nitrous oxide helps blood vessels open up, and that allows for blood flow and oxygen to get to the tissues. Now, without that blood flow and oxygenation, tissues start to become inflamed and damaged and age prematurely. Fascinating multi-step process here as far as trying to get nitrous oxide from our food. So our food has nitrates, such as green leafy vegetables, beets, things like that. We have to turn into nitrites, which then have to turn into nitrous oxide. So they did a part of what the study they did is they went to all these different whole foods around the country and they tested the nitrates content, and there is such a huge variability in the amount of nutrients in different products at Whole Foods, where Chicago had almost none, and other places like Dallas and Raleigh had a lot more. So quite some variability between what's in your food. But then you eat the food, and the good bacteria in your salivary glands and your saliva are required to break down the nitrates into nitrites. Now what they saw is that this disruption of good and bad bacterial mix, which we talk about all the time in autoimmune disease, as far as the gut and other body parts, where you want to have a lot of the good, not a lot of the bad. Well, the good-bad mix in the saliva helps break down the nitrates and the nitrites. But things like mouthwash, and there's over 200 million users of mouthwash in the United States, mouthwash kills the good bacteria. They are able to induce hypertension, tightening of the blood vessels, increase in systolic and diastolic blood pressure, create hypertension in healthy 20-year-olds within 7 days of starting using mouthwash twice a day. Now, fortunately, if you stop using the mouthwash, the good-bad mix returns to normal after 5 days. But you can imagine all the other disruptors of good-bad mixes like antibiotics, what they might potentially do. But also the third step is that you have to have hydrochloric acid in your stomach. And that's one reason why the proton pump inhibitors are so problematic. So the proton pump inhibitors, one of the acid-blocking medications, with 3 to 5 years of use, you increase your chance of getting a heart attack and stroke by 3 to 5 times. Now, the nitrous oxide also has to be available to liberate oxygen from the hemoglobin molecule in your red blood once they get to the end organs. And without the nitrous oxide, you can't even release the oxygen for use, let alone even get it there in the first place by the lack of blood flow. They showed up beautiful with autoimmune disease as our focus. They showed Raynaud's patients, the autoimmune disease that attacks the small blood vessels, ideally in the fingers and the toes. But if it gets bad enough and you attack the blood vessels even more, your entire body blood vessels get attacked, and you stop having blood flow to all kinds of body parts, and they can actually, at the worst case scenario, your toes and fingers and other body parts can turn black from lack of blood flow and oxygen and basically fall off. Now, the nitrous oxide increased production is able to open up these blood vessels, and they did a beautiful side-by-side thermography. We looked at blood flow into the hands and feet of people with Raynaud's, and what a profoundly a great improvement in the Raynaud's can come by increasing the blood flow. But as we also know, by getting rid of the autoimmune component, we can turn this around too. But part of that is the ability of nitrous oxide to help in the healing process, blood flow, oxygenation, etc. Thank you very much.